So what to do about vaccine planning? The safety of a COVID-19 vaccine is an absolute top priority. Many vaccines are being developed and tested, but some might be ready before others. CDC is planning for many different possibilities in which type of vaccine comes first and how we might best deliver that to the communities. At least at first, the COVID-19 vaccines might be used under an emergency use authorization from the U.S. Food and Drug Administration, and there may only be a limited supply of COVID-19 vaccines before the end of 2020, but the supply will continually increase in the weeks and months that follow. If there is a limited supply, then some groups may be recommended to get the first doses of the COVID vaccine. At first, the COVID-19 vaccines may not be recommended for children or pregnant women, and the cost will not be an obstacle in individuals having access to this vaccine. Finally, COVID-19 vaccine planning is being updated as new information becomes available. What do we know about the vaccine delivery? We know that CDC is going to work with 3 groups to distribute the vaccine once it's available, and this includes states, national pharmacy chains, and tribes. The prioritization of the first limited doses will be in a phased response, which we'll discuss next. What you can see here is the National Academies of Science, Engineering, and Medicine came up with a framework for equitable allocation of vaccine of the COVID-19. These phases are based on when the vaccine becomes available and the quantity of the vaccine that is coming with each phase. In the first phase, what we have is we have a prioritization of those individuals that are at the highest risk of the disease so that they will be the first ones who receive those first doses. In that first tiered group, we see individuals that are healthcare providers of individuals that are the most medically fragile or those who are caring for COVID-19 patients, as long as residents of long-term care facilities. Depending on the amount of vaccine that is available, these prioritization lists may be expanded or contracted based on the availability of the vaccine and the product available. Let's talk about the nurses' role in COVID vaccines. Nurses are the most trusted profession in the United States. Patients and colleagues are going to want to know your opinion about the importance of this and other vaccines. Your recommendation is going to be one of the strongest predictors of an individual's decision to be vaccinated. Some of the challenges to COVID vaccinations. We need to determine who is providing the vaccines in our community. With the phased release of the vaccine supply, it may be that some individuals are having to provide the vaccines in a hospital setting or some other type of setting. How do we make sure that we're able to get the vaccines to those who need the first doses of the vaccine? And how will we ensure that individuals receive that booster dose if it's required? How will we ensure that all individuals have access? One of the considerations is that some of these products have very low, ultra low cold storage and transportation requirements. So how are we going to ensure that individuals have shipping and storage for these ultra cold products and have delivery strategies to ensure that all have access? And is this going to include having different venues for the vaccine delivery, having hours that meet other individuals' needs as far as being able to receive vaccines after work hours or school hours? Are we going to use other delivery strategies, such as using drive-through clinics, going on to the workplace to provide vaccines? And finally, would you as a nurse volunteer in your community to help vaccinate individuals if needed? In promoting the vaccine, how do we as nurses get the information that we need to make an informed choice about the COVID-19 for ourselves and for our patients? ANA and others provide a wealth of the latest information on COVID-19 and the treatments and the updates on the vaccine research progress. If we don't trust the vaccines, we won't promote it to others. While waiting for the arrival of a safe and effective COVID vaccine, be proactive in receiving and recommending the seasonal flu vaccine. In dispelling myths, know where to find reputable information. ANA, CDC, and others have current information on the disease, the treatments, and the vaccine research process. Help patients and colleagues sort through the misinformation that surrounds both the disease and the vaccine. In having difficult conversations, try the AAA approach. The first A stands for ask. Ask what the individual knows about the disease or about the vaccine. Acknowledge any concerns they have or be able to clarify any misinformation that they have in their understanding. Finally, advise. Make a strong recommendation for the vaccine and also for treatments and other preventive measures. Finally, other considerations are to stay current on what is known.